On this edition for Sunday, October 4th.
Regarding his clinical status, the patient continues to improve.
The president remains hospitalized with a diagnosis of coronavirus, but his doctors say he could return to the White House soon. And roads to election 2020. Voters will decide the future of gig workers in the state of California. Next on PBS NewsHour Weekend.
PBS NewsHour Weekend is made possible by Sue and Edgar Wachenheim III, the Anderson Family Fund, Bernard and Denise Schwartz, the Cheryl and Philip Milstein family, Barbara Hope Zuckerberg, the Leonard and Norma Chlorfine Foundation, Charles Rosenblum. We try to live in the moment to not miss what's right in front of us. At Mutual of America, we believe taking care of tomorrow can help you make the most of today. Mutual of America Financial Group, retirement services and investments.
For 25 years, Consumer Cellular has been offering no-contract wireless plans designed to help people do more of what they like. Our U.S.-based customer service team can help find a plan that fits you. To learn more, visit consumercellular.tv.
Additional support has been provided by the Corporation for Public Broadcasting, a private corporation funded by the American people, and by contributions to your PBS station from viewers like you. Thank you.
Good evening and thank you for joining us. President Trump's doctor said today that he could be discharged as soon as tomorrow from Walter Reed National Military Medical Center, where he is being treated for the coronavirus.
Good morning, everyone.
At a news conference today, White House physician Dr. Sean Conley said that Mr. Trump has, quote, continued to improve.
As with any illness, there are frequent ups and downs over the course, particularly when a patient is being so closely watched 24 hours a day.
But despite the optimistic timeline, the medical team said they added a third medication, the steroid dexamethasone, to the president's treatment. Dexamethasone is an anti-inflammatory drug normally used to treat a range of allergic reactions, as well as rheumatoid arthritis and asthma, that has been found to reduce the risk of death in seriously ill COVID patients by about a third.
72 hours into the diagnosis now.
Yesterday, Dr. Conley and White House Chief of Staff Mark Meadows made conflicting statements about the president's condition. Today, Conley admitted the president did receive supplemental oxygen on Friday when he had a high fever and oxygen levels below 94%, and again on Saturday.
I was trying to reflect the upbeat attitude that the team, the president, that his course of illness has had. Didn't want to give any information that might steer the course of illness in another direction, and in doing so, it came off that we were trying to hide something, which wasn't necessarily true. So here I have it. He is the fact of the matter is that he's doing really well.
Doctors said the president received a second dose of remdesivir, a drug approved for emergency use in patients with COVID-19. Last night, Mr. Trump, who was not wearing a mask, shared a video recorded at the hospital.
I'm starting to feel good. You don't know over the next period of a few days. I guess that's the real test. So we'll be seeing what happens over those next couple of days.
For more on the president's diagnosis and treatment, I spoke with Dr. Craig Spencer, Director of Global Health and Emergency Medicine at New York Presbyterian Columbia University Medical Center.
Today's briefing, the Sunday briefing, certainly gave us more information than what we got yesterday. I think they did allude to the fact that they weren't completely forthcoming yesterday, and I think what they said is that they were trying to convey an upbeat attitude of the team, which is great, but I don't think that's necessarily what medical providers are supposed to do. We're supposed to report on what's actually happening, and I do believe that it's important for the American public to understand what's happening with the president's illness. This is both a health issue as well as a national security issue. We're in the middle of a pandemic that's taken over 200,000 lives in the United States. So I think we need more details.
One of the things that the doctor mentioned that they saw in his lung scans what they would expect to, and that there was nothing that was of clinical concern. So what are the things that you'd expect when somebody's going through COVID?
Well, I think it's most important to point out that they didn't say normal, so it means it's not normal. What I normally expect when I do an X-ray or CAT scan of someone with COVID-19 is what we call bilateral ground glass opacities or infiltrates. Basically, this kind of looks a haziness on both sides of the lung. It looks pretty characteristic for COVID-19. We've seen this a lot, so especially since March and April here in New York City. Other things, though, are possible. Pneumonias, other things that we may see on chest x-rays or CAT scans could also be considered normal in a COVID-19 chest x-ray.
There was a new drug added to this, a steroid, dexamethasone, and that has shown at least some trials to decrease the rate of mortality. Good idea?
It's really hard to say. I think we need more details. Yes, you're right. Dexamethasone, which is a steroid meant to reduce inflammation, is one of the medications that's been shown to have the most profound impact on decreasing mortality. That being said, the impact was primarily in patients who were being mechanically ventilated, so on a ventilator, or receiving supplemental oxygen. For patients who were not on oxygen, there was actually some hinting that it may make things worse as opposed to actually help. It's hard for me to speculate without knowing all the details, but if he were my patient, a 74-year-old man not currently on oxygen, I think there'd be a lot more questions. I need a lot more information before I decide to start that.
I want to ask about the experimental drug. Because he's the president of the United States, should he have sort of access to anything that's showing any promise, or should we be taking the most conservative approach possible because he's the president of the United States?
This is a huge ethical question. You could make the argument that right now we don't have really many magic bullets for this treatment, and the president of the United States needs to receive the best cutting edge care. There does seem to be a good indication that things like the Regeneron monoclonal antibodies are helpful and that the benefits outweigh the risks. Others are saying that this is treating the president as a guinea pig and is not the right thing to do. I think this is a discussion that needs to happen amongst the medical team, involving the patient and involving kind of everyone else that will be impacted by this to determine whether or not this is the right course of treatment. And I presume that's what's happened here, the same thing that would happen if I were taking care of a similar patient in my emergency department.
And to those folks who watch this and say, let's say best case scenario, the president recovers, is back in the White House in a couple of days, and decides to go back on the campaign trail and says, you know what, I don't need to wear a mask because I've already had COVID. What's wrong with that?
One, I still think that the president and everyone else in this country right now needs to set a precedent and wear a mask. If this virus can infect the president, it can infect all of us. It's not done with the US. It is going to continue to roll around in this country. And really one of the best things that we can do, in addition to distancing, washing our hands, being in pretty well ventilated areas, is wearing a mask. Now, we do know that for many patients, there is likely some immunity in the months following an infection with COVID-19. You build up antibodies. We suspect that that makes it impossible for the overwhelming majority of people to be reinfected. However, we've seen over a dozen cases of very well-documented reinfection in people who have already had COVID. So that means that immunity is certainly not 100% for 100% of people. And it's going to be really hard to say whether that's going to be the case for the president. I would recommend to him and everyone else that's had this to take the same precautions, because you don't know if you're one of those people who will potentially unlucky enough to have COVID twice.
If people follow you and have seen you before, it was in the wake of not just Ebola, but what happened this spring in New York City. We've heard doctors in Texas say it. This past week, it was doctors in Wisconsin talking about how overwhelmed their facilities are. When you keep seeing this, what goes through your mind?
We got hit on the head here in New York City. It's happened in Florida and Arizona and Texas. It will continue to happen in every community in this country that does not take it seriously. Just as I said in March, it remains true in October. If this virus finds you, it will infect you. And for a significant percentage of the people that are infected, they will have a negative outcome. They may die from this. And many of them, unfortunately, even if they survive, can have long-term consequences.
Dr. Craig Spencer, thanks so much.
Thank you.
For updates on the health of President Trump and the latest national and international news, visit pbs.org/newshour. New cases of the coronavirus increased at record levels in 9 states this past week. Reuters analyzed data showing states in the upper Midwest and West, where cooler weather is sending more people indoors, had the highest rates of new infections. Kansas, Nebraska, New Hampshire, South Dakota, and Wyoming set new records last week. Yesterday, 4 states, Kentucky, Minnesota, Montana, and Wisconsin, set new one-day records, according to the Reuters analysis. Johns Hopkins University's Coronavirus Resource Center shows the U.S. with more than 20% of all confirmed cases worldwide. As of this morning, there are close to 35 million infections globally, and nearly 7.4 million of those are in the United States. Violence between Armenian and Azerbaijani forces continued today over the separatist region of Nagorno-Karabakh. Ethnic Armenian officials from Nagorno-Karabakh took responsibility for the latest round of strikes in Ganja, Azerbaijan's second-largest city. 1 civilian was killed and dozens were injured, according to Azerbaijan's government. The decades-long dispute between the countries is over the Nagorno-Karabakh region, which is part of Azerbaijan but is controlled by ethnic Armenian forces backed by Armenia. Both sides have accused the other of targeting civilians. Pope Francis says that the loss of millions of jobs due to the coronavirus pandemic proves that the magic theories of market capitalism have failed the world. At the Vatican today, the Pope released a 70-page encyclical, the highest form of papal teaching, to the public after traveling to the town of Assisi yesterday. It was his first travel outside of Rome since late February. In his vision for a post-COVID world, Francis called on world leaders to listen to popular movements and marginalized groups and to form a new type of politics promoting dialogue and solidarity. The Pope criticized the idea that all societal problems can be solved by market freedoms. The written teachings, titled Brothers All, covers a wide range of topics including immigration, populism, and economic justice. We're continuing our series Roads to Election 2020 today with a look at the state of California, where 21 million ballots, more than any state in the country, will be mailed to registered voters by tomorrow. On that ballot will be a decision on the future of gig work. Companies like Uber, Lyft, and DoorDash want their ride-share and delivery drivers to be classified as independent contractors, but a new state law categorizes them as employees. In response, Uber, Lyft, and other gig companies are funding the most expensive ballot measure in the state's history and putting it to California voters to decide. NewsHour Weekend's Laura Fong has the story.
App-based drivers have organized across the state from Los Angeles to San Francisco, calling on the gig companies to start treating them as employees under a new state law that went into effect earlier this year. Last year, the California State Legislature and Governor Gavin Newsom passed a law known as AB 5 that narrows the definition of an independent contractor. It codified a California Supreme Court case against a same-day delivery company called Dynamex that ruled in favor of workers who claimed they were, quote, misclassified as independent contractors. The AB 5 law requires that a worker must meet 3 factors under the so-called ABC test in order to be considered an independent contractor. The person must be free from the control and direction of the company, performs work that is outside the usual course of the hiring entity's business, and is engaged in an independently established trade, occupation, or business. Under the AB 5 law, rideshare and delivery apps would have to give employee protections to their drivers, such as paid sick leave, unemployment insurance, and overtime. But Uber, Lyft, and other app-based companies have fought AB 5 in the courts, and before the bill came into effect, they drafted an opposition ballot measure, Prop 22, that lets voters decide the issue this November 3rd.
Prop 22 is the solution we need. 22 would allow app-based drivers to continue working as independent contractors.
Prop 22 overrides AB 5 and creates new benefits for app-based drivers, including an earnings guarantee tied to 120% of minimum wage and a healthcare subsidy starting at 15 hours a week. But critics of Prop 22 say it doesn't offer as many benefits as employee status, and the benefits only cover the engaged time when drivers have passengers.
My name is Doug Mead. I am an app-based driver based in Palm Springs, California.
App drivers Doug Mead and Elizabeth Clues support Prop 22. They say that the flexibility of being an independent contractor allows them to set their own schedule. Clues is a single mother of 2 young children and in college. She began working for DoorDash as a delivery driver this year when she lost a waitressing job during the height of the pandemic. She says the schedule and pay is better than what she made as a waitress.
I like being able to cash out immediately. I mean, I have kids, they have immediate needs that, just pop up, they need diapers. I don't necessarily have cash. I can go do 2 deliveries and I can go buy diapers.
I started part-time originally just to kind of get out of the house for a few hours a day. And
Doug Mead drives for Uber Eats and Postmates and has a heart condition. He says the job allows him to take the breaks that he needs.
if I decide after 2.5 hours that I'm a little tired and I need to just take a rest, I can just simply turn the apps off. As an independent contractor, I'm essentially running my own business. And if I'm running my own business the right way, then I'm able to put aside money for healthcare. I'm able to put aside time for sick leave or for vacations.
Rideshare apps Uber and Lyft and delivery apps DoorDash, Instacart, and Postmates have collectively put more than $181 million towards the Yes on Prop 22 campaign, making it the most expensive ballot initiative in California history. The opposition campaign, meanwhile, has a little over $5 million, primarily from union groups.
There are stories of drivers who have lost their lives, yet our companies once again were nowhere to be found.
Sherry Murphy and Eden Alva are Lyft drivers who oppose Prop 22 and have organized actions with worker advocacy groups such as Gig Workers Rising. This one is outside the house of Uber CEO Dara Khosrowshahi.
Gig Workers Rising is an organization that advocates for fair wages and protections, labor protections.
Murphy began driving 3 years ago while she was in graduate school to become a minister.
The idea of a flexible work situation was attractive to you.
So it seemed like an answer, a godsend, a job with a feature that allowed you to make money after completing a sermon or a paper. They were also able to provide you with a rental vehicle. And over the years, as the number of bonuses decreased while the demands to complete rides increased, making major cuts to take-home pay, it was becoming increasingly difficult to sustain a living.
For Eden Alva, he began driving for Lyft part-time 6 years ago as a way to supplement his income. But then he lost his primary job with benefits and turned to Lyft full-time.
The moment I started doing Lyft as a primary source of income and did rides according to their schedule, not mine, that's when the problems began. They kept cutting and cutting and cutting their pay until it dropped below minimum wage when you deduct expenses.
Alva said that even though he got sick with the flu in January, he could barely afford to take days off. As an independent contractor, he had no paid sick leave.
I had no choice. I had to continue working. I worked just until I earned enough money to pay my rent. And then I physically just couldn't work anymore, and I still couldn't see a doctor because I couldn't afford it. I luckily have the friends and the family that helped me in that situation. But over the years I've been doing this work, I've met plenty of drivers who do not have the system of support that I happen to have, and who end up homeless or living in their cars because of regular mishaps that happen to them.
In April, Alva said the earnings were so little and the health risks were so high to work in a pandemic that he decided to quit.
Disinfecting the car and buying disinfectants for the car and buying protection gear for myself.
In May, after employment claims skyrocketed due to the pandemic recession, California Attorney General Javier Becerra and city attorneys from San Francisco, San Diego, and Los Angeles sued Uber and Lyft for misclassification of drivers and claimed the companies have exploited hundreds of thousands of California workers. A University of California Berkeley study estimated that Uber and Lyft would have paid $413 million into the state's unemployment insurance fund over the past 5 years if workers were treated as employees.
I know what it's like to be misclassified and having to struggle for 3 months to get unemployment in the middle of a pandemic.
Sherry Murphy, like other gig workers, found she couldn't get unemployment insurance because Lyft didn't classify her as an employee. She says the fight over this ballot measure is critical for worker protections.
It's a smoke and mirror attempt to convince voters to be complicit with stealing and cheating their way of that responsibility. And so I know that there are a number of voters who are voting to hold Uber and Lyft and DoorDash accountable by voting no in Proposition 22.
Reporter Sam Harnett covers tech and labor for Public Media's KQED. I spoke with him for more on California Proposition 22 and what it can get done if it passes.
So Uber and Lyft want to continue classifying their workers as contractors, which means they don't have to pay for things like unemployment insurance, overtime, they don't have to have guaranteed minimum wage. So they put this proposition on the ballot, which gives California voters the ability to vote on it. And if Proposition 22 passes, these workers will be labeled as contractors. And the only way to get rid of that then will be for 7/8 of the California legislature to overturn the proposition. So it's a huge vote. So if this passes, Uber and Lyft drivers are going to be contractors for the foreseeable future.
So what has the pandemic done in the middle of this 8-year-long struggle to figure out if somebody's an employee or a contractor? Here comes this unforeseen event that changes how we live and work, and more important for this business, move about.
Right. I'd say the pandemic did two really big things. First thing it did was suddenly you had all these Uber and Lyft drivers that didn't have work anymore, but they couldn't collect unemployment because Uber and Lyft, by classifying their drivers as contractors, have not paid 1 cent into the state unemployment fund. So suddenly you got tens of thousands of drivers going like, I can't get a ride, can I get some money? And the California unemployment fund is like, we don't have any money for you. So I think that really motivated California lawmakers to move on this because there was a real monetary issue. The second thing that it did is Uber and Lyft have consistently relied on their consumers, on their riders to basically put pressure on regulators. Basically, they've gone to riders love Uber and Lyft because it's very cheap, because the companies don't pay their workers that much. So they've relied on the consumers, and in the past, that's been very successful. Again, in places where they've threatened to leave, consumers have been really upset, and politicians have then helped Uber and Lyft get the regulations that they wanted. But with the pandemic, suddenly people aren't riding as much. So Uber and Lyft have lost a little bit of that leverage because people simply aren't taking as many rides. And that's sort of opened the door for the Attorney General to sue these companies and not risk public backlash from consumers, and for this basically issue to come to a head.
We talk about Uber and Lyft, but this is really a bellwether for the entire gig economy. There's lots of other companies, as DoorDash or TaskRabbit or other companies that have sprung up with the same business model. Is there any indication that there are other states watching what happens in this election, and then really that it could have an impact much bigger than just the ride-sharing economy?
Absolutely. So, the issue that's playing out in California over how to classify these drivers is playing out in every other state in the country, and actually globally in different countries around the world. So everyone is looking to California to see what's going to happen. Now, the thing is that the way the proposition is written is that it only applies to people working on platforms doing delivery or transportation. So again, companies like Uber, Lyft, but also Postmates, DoorDash. So it's limited in who it's targeting now. But if you create this precedent of having a basic third option between employee and contractor, this kind of contractor, and we didn't explain this, but the proposition would give them contractor status with slightly improved benefits, slightly better wages, some health supplements, some insurance if you drive a certain amount of hours. So the point is, if you create that third category, the worry is that a bunch of other corporations are going to look and be like, hey, that's a great way to save money. Let's maybe create an app for our trucking service or our delivery service. And then we can, instead of, paying the workers as employees, we can use this kind of contractor plus model. Right. And again, if you look at the history of the independent contractor in America, this was added, the independent contractor model was added as a caveat for very specific kinds of situations. And then you saw corporations over time moving more of their workforce from employees, which are expensive because they have benefits and protections, over to contractors, which are cheaper. So again, the worry is you make this third way, and companies are going to find a way to exploit it.
Sam Harnett, KQED, thanks so much for joining us.
Yeah, thanks for having me.
California has 1/4 of the nation's eligible Latino voters, but it was not always that way. A PBS SoCal documentary, Prop 187, The Rise of the Latino Vote, explains how an anti-immigrant ballot proposal more than 25 years ago mobilized Latinos to register to vote. For more, visit pbs.org/newshour. NewsHour will have more this week on the state of the president's health and how it may affect the upcoming election, which is now less than 1 month away. That's all for this edition of PBS NewsHour Weekend. For the latest news updates, visit pbs.org/newshour. I'm Hari Srinivasan. Thanks for watching. Stay healthy and have a good night.
PBS NewsHour Weekend is made possible by Sue and Edgar Wachenheim III, the Anderson Family Fund, Bernard and Denise Schwartz, the Cheryl and Philip Milstein family, Barbara Hope Zuckerberg, the Leonard and Norma Chlorfine Foundation, Charles Rosenblum. We try to live in the moment to not miss what's right in front of us. At Mutual of America, we believe taking care of tomorrow can help you make the most of today. Mutual of America Financial Group, retirement services and investments. Additional support has been provided by Consumer Cellular and by the Corporation for Public Broadcasting, a private corporation funded by the American people. And by contributions to your PBS station from viewers like you. Thank you.
You're watching PBS.